This is the first time I've given a presentation without a PowerPoint, so I'm going to kind of wing it here. But I'm going to talk to you about our program here. We have a robotic institute here. It's not just a few robots. We actually have 3. But there's more to a robotic institute than just the robots that we have to use. We have clinicians, 45 or so, who are surgeons who operate on this robot, on the robotic systems, and there are all different subspecialties. So 7 different subspecialties, types of surgeries are being performed on these robots. This program started in about 2011 when we first acquired an SI robot. We have 2 of those now, and we have the latest, which is an XI robot. It's on display here tonight. That's our big daddy. So basically, I want you to enjoy that and kind of get a feel for what it is to operate with a robot. And you might say, why a robot? Why do you need a robot for surgery? There are many reasons. First and foremost is that we want to increase the number of patients that can have minimally invasive surgery. So laparoscopy, is the small incisions in the abdomen or in the chest or multiple places, pelvis. They are used to access all kinds of organs and do all kinds of procedures, but there are limitations to laparoscopy, right? So the surgeon is standing at the bedside and has an instrument going into the patient, and if they want to lift something up inside the patient, they have to push the handle down on that instrument, and they're looking at a screen. So it's a lot of hand-eye coordination and opposite motion to get the effect that you want. Well, robotics takes that completely away. So robotics is an interface, it's a computer interface between the surgeon and the patient that is completely immersive, which means that the surgeon is actually sitting away from the patient and sits down at the console, puts their head in the console like you can do tonight, and puts their hands in these instrument controls. And everything that the surgeon does with their hands happens at the tip of those little tiny instruments inside the patient that is laparoscopically placed. The surgeon can also see 3D and HD. So traditional laparoscopy is 2D. We do have some 3D cameras that are coming out or available now. But it makes you feel like you're actually inside the patient's abdomen or chest or pelvis, and you're looking at their organs like this, like an arena. So you have peripheral vision inside the console. You have direct control of those instruments. You completely can move your wrists like you can naturally, but you can't do with laparoscopy. So all of these things, and the fact that you don't have to stand there and hold the patient's abdominal wall up with these instruments, mean that we can operate on patients who are bigger or who have more complex pathology. We can do procedures that we never dreamed that we could do laparoscopically before. And so what does that mean for the patient? That means instead of staying in the hospital for 3 days, that they get to stay in the hospital overnight or less than 5 hours after their surgery in most of my cases. So the patient goes home the same day, their recovery is faster, their need for narcotic medication is less, they can get back to their normal lives a lot faster. And that's what we want. That's what we want to offer our community. We want to give them the latest and greatest. We don't want them going down the road to get it somewhere else, and they don't have to. So as a result of our program here, we have probably the 5th busiest, or within the top 5 busiest programs in the entire Chicagoland area. We have 2 Center of Excellent Teaching designations in our subspecialties. We have 880 cases a year on the robotic systems. It's a very robust robotic program. We're doing research, we're collecting data. All of those things mean that we're more than just another hospital with a robot. So I hope you enjoy the robot tonight. I'm done. Okay, and I want to introduce Dr. Zengao. Did I say his name right? I just met him tonight, and he's an awesome guy. And I'm jealous because he has really cool equipment to use.
Hi, thank you for coming tonight. Thanks